PPS 2019. I am Shirokobrod and Dr. Fung. As every year, Ben and I travel to PPS, and aside from mingling, connecting, networking, we really like to get to the heart of a question that we think is important. And this year, it's a twofold question focused on the future. First, Ben, the first side of this coin, what opportunities do you see forthcoming in the industry of physical therapy, maybe even healthcare, in the next 3 years? But the flip side is, well, what's the threat? What do we need to watch out for? What is going to be a negative in our industry that we need to look out for, prepare for, and perhaps find an innovation to work around and turn that into a concept? Yeah, there's always adjustments, and what we're really interested in is we have a lot of business leaders at this conference. We're going to pull some of these people to the side and really see how creative they are looking at the future, and we can't wait to hear their answers. Stay tuned, let's get to it. What do you see as one of the big upcoming opportunities for the physical therapy industry?
I think one of the biggest opportunities in physical therapy, knowing the rules and regulations as they are today, I would say I think it is going cash-based. I know cash-based is not something new. I think it is going cash. It really is going cash-based. I have more and more clients now that are going out of network. They're not signing the contracts with the insurance companies, and they're getting the patients that their businesses are more profitable now being cash-based and being out of network than when they were being in network. I also think telehealth in the future. And again, I know we're not there yet because the Medicare program and most payers don't recognize telehealth, that we don't have the codes really to use, but I know there's a lot of people around the country doing telehealth legally and within the scope of practice on a cash-based business. I think it's also the fitness, the wellness, the prevention, capturing those patients when they're done with physical therapy and keeping them, so more on the preventative side. Even maybe before they have an injury, can we do prevention and get people to pay for those services?
All right, so one emerging opportunity, I only know one opportunity, and it's emerging, and that is upstream models of care. The idea of getting ahead of disease and managing risk, and really helping people to stay ahead of the really chronic disease, maybe with musculoskeletal is kind of the early window into that, but chronic diseases like heart disease, diabetes, cancer, Alzheimer's, mental health, anxiety, depression, all of those things are emerging and are well within our grasp if we're willing to think about risk and upstream models.
So the one opportunity I see that us as physical therapists have is to really push ourselves more into the wellness space and to really treat the whole patient, looking not only just at their specific injury, but their whole body mechanics. Also looking at their nutrition and how they're feeding their bodies, what they're putting in their bodies, looking at their mental status and where they are with that. Really kind of treating the whole person and their whole environment. I think we can really move into that space, and we haven't really taken advantage of the opportunities there.
The biggest opportunity, I think, for PTs is our ability to truly actually, now that direct access is across the U.S., has become that primary care practitioner that we've kind of always imagined, or at least for the last 10 years have been talking about. I think we have such a breadth of knowledge and a depth in our particular field. If we can educate the consumer enough to make them understand that, I think there's an opportunity to really become that primary care provider.
I think for me personally, I have to speak to my one true passion, which is advocacy. And I believe that as an association, we have grown over to be 100,000 members. Our collective voice, we truly are #BetterTogether. And I think if we can collaborate together and become unified in our message, we can really make changes on a federal and state level to change the system within which we all practice. We can complain all we want, but we have to step up to the plate to try to get that change to happen, to participate in the advocacy at the federal level and state to try to help us to practice with ease, with more efficiency, with more happiness for ourselves and for our patients. And I think it's very important.
I think the challenge we're facing right now as healthcare in general is all these private equities that are moving in and buying our practices and really affecting the way that we treat patients and making it more of a for-profit business rather than treating people and making them feel better. So I see that as a real challenge, but also an opportunity for us to do something about it.
The biggest challenge is, I think, on the flip side of that, we are trained in school to be still kind of more subservient practitioners. And even in practices and hospitals, everything is delegated to us, and we're, in essence, told what to do. The patient comes to us with a prescription still most of the time. So there's a mindset flip that needs to happen for practitioners to actually truly take the role of a primary care practitioner, and has to start internally of valuing ourselves like that. If we can value ourselves internally like that, that's when we can actually bring it to, bring it externally to the outside.
As far as problem, obviously I think anything when it comes to politics or legislation, it is slow. Congress is divided, but I don't think that should thwart our efforts. We can come together as a profession and try to work with the government and Congress to try to pass things such as the Connect for Health, the telehealth. We just got some numbers yesterday. Telehealth, trying to reduce the opioid crisis epidemic. So I think these are really important things. Even though it's a challenge, we can try to come together to face head on.
I think the consolidation, I think we're seeing a lot of the small, quote, mom and pop physical therapy owners that may only have 1, 2, 3 clinics are selling to the bigger entities. A lot of private equity investors and private equity groups are coming into the market that never were in the market before, and they're paying some nice multiples to these practices. So you see in some practices that may only have 1 or 2 clinics each, there might be 6 or 7 of those types of clinics coming together to form an entity. So now you get maybe 10, 12 clinics, but it could be 6 owners, 7 owners, and then they're taking that out to be a broker to the private equity investors. So instead of, say, Rick going to physical therapy, having 1 clinic and maybe getting a 3 multiple, Rick going to physical therapy joins with 7 other clinic owners. We now have 13, 14 clinics with a nice EBITDA.
Yep.
And now do we get a 10 multiple, a 12 multiple, things like that.
Now, why do you see that as an issue?
Because I think it could, again, I think it depends who buys the practices and all that, with these private equity investors and all that, but could it become more on, quote, profit over quality? Because as private equities, when they purchase something, they usually want to double their money within a certain time frame.
Yeah.
Well, how do you double your money?
Or 10x their money.
You're gonna have to increase volume or get better insurance contracts.
The emerging threat, I would say, is irrelevance. And I hate to be such a downer, because I think that's something that is hard for us to kind of think about. But if we don't move, if we don't change, if we don't jump into some of those emerging areas like upstream care, we will be irrelevant as a provider. We're getting more and more costly to provide our services, and there are technologies and systems that can do it just as well, if not better. That is a threat of irrelevance.